Hi, Kevin Henry, the Group Editorial Director for Advanced Star, and I'm on a Google Hangout today with Dr. Dennis Abbott. Dr. Abbott has helped us author an ebook on the topic of oral cancer and also has a webinar on the subject. And Dr. Abbott, would you just kind of give our viewers a little bit of your background, please?
Sure. My name is Dr. Dennis Abbott. I'm founder and CEO of Dental Oncology Professionals, which is an oral medicine practice in Dallas, Texas. I'm also on medical staff at the Baylor University Medical Center's Charles A. Sammons Cancer Center. We've also had an opportunity to work closely with the American Cancer Society in developing guidelines for oral cancer survivors. So that's kind of what we do.
And Dr. Abbott, I know you lecture throughout the country on the subject of oral cancer. Can you kind of give our viewers some of the hot topics that you're often asked about whenever you're at lectures?
Absolutely. One that I get a lot is if we're out there and we're screening for oral cancer and we end up with a negative biopsy result, what do we do with that? And is it bad if we have negative result and negative result and negative result? And I think that the point that we have to understand is that if we're not screening for oral cancer and if we're not looking for it, then we never are going to have the opportunity to have those negative results. And I've never had a patient who has been disappointed with a negative biopsy result before. So I think that the point is that we are in a position to see patients sometimes more often than physicians, and we are in a position to get to really know and talk with our patients maybe longer than physicians do. And whenever it comes to the mouth, we really have to be diligent about screening for oral cancer. So I think that the fear of having a negative biopsy result really has to be superseded by the ability to help and care for the patient's well-being.
Is the fear of finding oral cancer, is that one of the main roadblocks that you see out there to why practices aren't screening right now for it?
I think that that's part of it too. What if it does come back positive? And what do we do from there? Where do we go? I think a lot of dentists are not familiar with kind of the progression of the patient, or so to speak, where the patient needs to go. So, from a positive biopsy result, obviously, if the dentist is doing the biopsy in office, then he or she is the one who needs to deliver the news to the patient. And that needs to be done quickly because time is of the essence for the patient's health and well-being. And they really need to be able to encourage the patient to go ahead and seek treatment. And that next step is going to usually be a surgeon. And so an oncological surgeon, usually an ENT, someone who is trained to do surgery on cancers. That's really the next step. So I think that is part of it too, is hey, I found it, I have to be the one to deliver the news, or if you referred for biopsy, then the doctor who did the biopsy will be the one to deliver the news, but then to get the patient pointed in the right direction just to seek out somebody, and that can be easily done by getting to know some of the doctors at a local oncology center or in your area who you could refer to.
And that actually led to my next question is, we hear so much about the medical-dental collaboration and where that's kind of going next year, and this is a perfect opportunity for that, correct?
Absolutely, and I think that, in what we do in my practice, being a dental oncology practice, meaning that we take care of the side effects of cancer, whether that be oral cancer, whether that be breast cancer, prostate cancer, it doesn't matter. So we're taking care of the side effects of chemotherapy and radiation therapy for these patients and making sure that they are able to maintain their oral health throughout. So, the point is that I think that, we have this opportunity to be in this area where it does really bridge the gap between medicine and dentistry. And I think that any kind of cancer-related care, whether it be oral cancer specifically or something like dental oncology, where we really have to use the collaborative process between medicine and dentistry, is just going to increase over time. And I really think that this is where we're headed as dentists, is more of a collaborative nature, really looking at systemic health overall.
And certainly we want to encourage you to download the ebook on dentalproductsreport.com about oral cancer detection, and then follow up with the webinar that Dr. Abbott leads on. It's a 1-hour CEU webinar about oral cancer detection. And Dr. Abbott, if people have more questions for you, where can they reach you, or is there a website that they could find you on?
Absolutely, yeah. There are a couple of different websites. Our website is www www.dopnt.com. So Dental Oncology Professionals of North Texas.com, dopnt.com, or you can go to www.drdenisabbott.com. DrDennisAbbott.com is my speaker site. My email address is drabbott@dopnt.com, and I can be reached there anytime.
Well, Dr. Abbott, thanks so much for all you're doing in the battle against oral cancer, and we certainly appreciate your time this morning.
You're welcome. Thank you.